agenesis of the corpus callosum, or the connection between the two portions, the two sides of the brain, can have variable outcomes. And the diagnosis is not that easy to make. So during your pregnancy, you will undergo a number of ultrasounds to determine whether or not the corpus callosum is present or partially present. And this will be confirmed with a fetal MRI, which can occur anytime between 22 and 34 weeks of pregnancy.
Your doctor will recommend that you have an MRI of your fetus's brain if, based on the ultrasound findings, they suspect that your fetus has an abnormality of the corpus callosum, or they cannot identify with ultrasound a structure known as the cavum, septum, pellucidum, which essentially can be a marker for callosal development. In these cases, the MRI is helpful because, unlike ultrasound, it actually lets us look directly at the corpus callosum. And with MRI, we can determine whether the corpus callosum has formed or whether it is completely absent. And if it has formed, we can determine whether or not it has completely formed for the stage of the pregnancy. Also, by directly looking at the fetal brain using MRI, we can determine whether or not the other structures in the fetal brain are developing normally for this stage of your pregnancy. And it is this information that we gather from the fetal MRI in terms of the callosum and how much it has formed or whether it has formed at all, and whether or not there are additional abnormalities in the fetal brain that your doctor will then use to give you the most accurate information about what to expect.
If the diagnosis is confirmed and this is suspected to be the issue, then you'll be followed throughout the pregnancy with serial ultrasounds at about 4 to 6 weeks apart to make sure that the baby is growing well and thriving. And ultimately, delivery will be by vaginal delivery unless, for whatever reason, you need to have a cesarean section, just like any other baby. The baby does not need to be induced early. You can wait for natural labor to occur, and the baby will then be evaluated by the pediatric usually neurologists to start with, after delivery.